Welcome to our presentation around working in partnerships and quality improvement with integrated sexual health services. Within ISH, our model of work is working in a layered way for a full system approach. This means working with the person around their individual needs, moving on to working with partner agencies and how they can support people's sexual health, right the way up to specialist interventions and what we provide in our clinical settings. Prevention and self-care at a universal level is important to us in sexual health. Partnership working is key to this. We work very closely with our partners in the voluntary sector. This meets the need of local community members and it's delivered by a person that they trust in a place that they feel comfortable. We do this because it allows better engagement for our people and access to sexual health services that might not have happened if they weren't working with that voluntary sector organisation. We also offer condom provision across all ages within Derby and Derbyshire in a range of venues and a range of ways to support the person to self-care.
Hello, my name is Ryan, Manager and Sexual Health Champion at Derbyshire LGBT+. Our sexual health contract allows us to target some of the highest risk communities in Derbyshire and Derby City. We can deliver sexual health awareness and education sessions in a way that is accessible to our community and in a way that makes sense to them. We are now also an offline kit distributor, which means we can distribute SH24 screening kits directly and immediately to our community. And this means we're reaching people that might otherwise never engage with service. This really has been a huge development for us. This service, along with our targeted education and awareness programme for PrEP, will hopefully have a lasting and tangible effect on the sexual health of the LGBT+ community in Derbyshire and Derby City.
Sexual health promotion are a key function within integrated sexual health services. They provide community-based sexual health interventions, which include education, sexual health testing, and condoms. The team work to target communities who might find it more difficult to access generic sexual health clinical services. This might be due to the geographical place where they live. It might be through lifestyle. It might be through having some misconception of stigma around attending sexual health services. The team deliver a range of techniques. They work out and provide educational workshops. They go out and work within local community venues so that they are most accessible to a range of people. As we can see, we have our sexual health promotion bus. This is one of the ways that we were able to go out into local communities and think about how we can improve the quality of our service. This enables us to get to locations that generic clinics can't set up and pop up. It allows people to come along and see us in a range of places across Derby and Derbyshire where people might not have seen sexual health services before. We also have specific roles within the sexual health promotion team to work with communities to encourage better engagement within our services. For example, we have an ethnically diverse communities worker who works within communities from diverse backgrounds across the county and city in safe spaces for them. This project enables people to access sexual health care in a place that they feel safe who wouldn't otherwise access sexual health care.
We run 4 sexual health campaigns each year. Campaigns like the current PrEP one are evaluated and reviewed with improvement in mind to make sure we're reaching the right people at the right place to receive the information they need to make informed decisions around their sexual health.
Community Action Funding is a grant-based project set up by Sexual Health to support smaller grassroots organisations to access small pots of funding for a project within their community to improve knowledge and awareness of sexual health services. Within sexual health, we support the application process and the project itself. And at the beginning of the project, we train workers in basic sexual health awareness. Within the last year, we've had 14 projects that were successful, working in a range of creative and innovative ways to engage people that may not have accessed mainstream sexual health services before and therefore might not have encountered our messaging. Partnerships and co-production are so important within sexual health. Sharing these messages through local people telling that story has enabled better quality delivery to engage and connect with community members much easier in front of them, meaning the messaging is better received. Sexual health networking events are another way that we bring professionals together. It allows people to have a shared understanding around sexual health messaging and learning together. They can then take these messages back to their workplaces and a ripple effect of learning can occur. Working with GP and pharmacy partners allows sexual health care to be accessed in many more locations. It also allows patient choice to access where they would like to in a range of places and providers. We work with the partners to train and support them to make sure that the quality of care is of a high standard whichever place the patient attends. Within our clinical sexual health services, we have seen quality improvements over the last year. These are some of the ways that we have been delivering this: through improvements in results, partnering with the primary care network to provide a sexual health clinic on our behalf, taking on the lead provider role with vasectomy services and HIV services in the North, and contributing to the national agenda. These interventions are allowing us to search for improved service delivery, efficiencies, and reducing stigma in sexual health.
Hi, I'm Vicky, I'm the Senior Health Advisor for the service. We have improved our results process by working collaboratively with the laboratories, looking at reducing the turnaround time. We've been able to reduce our notification times to patients by making changes to our process. Staff are all on board with this as the new process includes some automation, therefore freeing them up for more complex patient work.
Being a lead provider within the system, we play a key role in moving the sexual health agenda forward. However, we are invested in making sure sexual health improvement is a system approach, and only by having a shared collaboration we can truly move this agenda forwards. Over the last year, we have used different methods to achieve some of this. The sexual health needs assessment, making sure we had a local community engagement assessment to hear local people's voice. Sexual Health Action Research Project, the SHARP project, was a research project within the community to hear from our patients who currently access our service, from our staff, and also from non-patients, people who don't already access our service, so we could really hear how we could improve our service accessibility. We also work within the Sexual Health Alliance. This is a strategic partnership group to decision make around shared system approach for the sexual health agenda within Derby and Derbyshire. So what does this all mean? This gives us a longer term vision, planning and impact to improve the Derbyshire and Derby sexual health system. What's next for us in integrated sexual health? Well, based on the research and data that we've completed over the last year, we will be refreshing our sexual health strategy. We have an electronic patient record, allowing patients to make their own bookings and be in control of their own information, allowing the service to be more accessible to them. We're trialling some in-house lab testing facilities. And finally, we're hoping to introduce the IQ-PAN. This is a service improvement tool which allows us to look at data in a variety of different ways. For example, at patients' ages, ethnicity or disability status, enabling us to monitor who is attending our settings and showcase to us any gaps to look for areas of improvement.